I am Kiddada Green, the founding director of Black Mothers Breastfeeding Association, where we're building unbreakable bonds of love by helping mothers to breastfeed. We believe that it's a small investment for a lifetime of wellness. Black Mothers Breastfeeding Association is a nonprofit association that was established in 2007. Our mission is to increase the awareness of the benefits of breastfeeding throughout the African American community. We have a vision to improve the health of the African American community by increasing the number of Black mothers who breastfeed, as well as the amount of time spent doing so. We have been working hand in hand in the community with mothers for 5 years through our Black Mothers Breastfeeding Club, where we provide support, resources, and educations to mothers, families, and support partners, so that pregnant and breastfeeding mothers have the information, support, and knowledge that they need to initiate and sustain breastfeeding efforts. Breastfeeding impacts infant mortality and childhood obesity. In Michigan, 5 out of every 1,000 Caucasian children who are born die from infant mortality. 7 out of 1,000 Hispanic children die from infant mortality. However, for Black children, it's an alarming rate of 14 per 1,000 deaths per births in the state of Michigan alone. Breastfeeding, if those children were breastfed, that number could be sliced in half, and that's what we intend to do. Breastfeeding also is the #1 and the first and #1 preventer to childhood obesity, as well as other childhood illnesses. So why is our focus on Black moms? Well, in the state of Michigan, only 50.9% of African American babies are ever given breast milk. That means that only once, it could have only just been one time, it could have been 10 times. But of all the children born, only 50% are given breast milk. And at the age of 6 months, that rate drops to 22%, as compared to white babies who are initiated breastfeeding at a rate of 68.5%. In the United States, the cost savings in the nation would be $13 billion if we had a 90% breastfeeding rate across this nation. So we are working directly hand in hand with the community and mothers to change this. So what's our innovation? We are taking our strong alliance and our insight and relationship with the community that we do with mothers to provide culturally and relevant, appropriate training to huge entities that have an interest in maternal and infant health. We have contracted with several hospitals, WIC agencies across the country. La Leche League, Center for Disease Control called us directly to ask for us to consult on their Black-white disparities, reducing on we helped write a paper to reduce Black-white breastfeeding disparities for the Center for Disease Control. We were also contributing authors to the United States Surgeon General's Call to Action on Breastfeeding, and we have also contracted with the United States Office on Women's Health. Currently, we are contracting with Michigan Department of Community Health, and we also have contracts with and sponsorships from breastfeeding pump companies like Medela. So we will continue to make money by contracting our services through consulting, annual events like seminars, corporate contributions and sponsorships, memberships, foundational grants. We're a current grantee from the Kellogg Foundation of $100,000 to optimize the first food experience for Black babies in Detroit. And we're going to begin national chapters of Black Mothers Breastfeeding Association. We are your connection to the community and eliminating those breastfeeding disparities that exist.